Namaste is the new normal
No, this
in
is
the
Dr.
COVID.
Rajendrakumar's profile.
Good morning. Saying Namaste is the new normal in the COVID era. With the unlock, it's time for all of us to reset and restart our lives in the COVID era. I, Ms. Siddhi Malgaonkar of Mayor Vitebad, on behalf of my organization, I am pleased to welcome and thank all the delegates who have registered and attending this webinar with us today. Mayor Vitebiotics is the global business partner of Vitebiotics UK, headquartered in London, which is the UK's #1 and world's fastest growing nutraceutical company. Dr. Kartar Singh Lalwani is the founder and chairman of Vitebiotics. He is a bioscience inventor who has successfully commercialized his own inventions. Mayor Vitebiotics is one of the leading pharmaceutical manufacturers in India. Mayor has created unique portfolio of products for addressing the needs of men and women. In today's scenario of COVID-19, we have realized that the micronutrients and vitamins play a major role for stronger immunity. For this, Mayor offers a total healthcare therapy in the form of Well Man and Well Woman, a comprehensive formula for men and women containing essential micronutrients and vitamins A, C, D, B6 and B12 with folic acid which contribute to the normal function of the immune system. So today, Mayor Vitebiotics provides a unique platform to connect, engage and create an avenue towards robust exchange of information on proven efficacies of micronutrients in wellness through the ages under the guidance of the leading and eminent speakers Dr. Rekha Rajendrakumar and Dr. N.Rajendrakumar. Now I'd like to introduce our eminent speaker for the today. Dr. Rekha Rajendrakumar is a medical director and IVF consultant at Miracle IVF Hospital, Chandana Hospital and Gynec Endoscopy Center at Bangalore. She is the speaker, chairperson, moderator, panelist in more than 300 state, national and international conferences. She is an postgraduate teacher of MS Ramaya and Bangalore Baptist Hospital. She has many accolades to her credit. She is an All India topper for ICOG Reproductive Medicine examination. She has been ranked 7th in Bangalore University. She has 6 awards and 3 felicitations, including 2 state awards, Kittur Rani Chennamma State Award. Now, I would like to introduce Dr. N.Rajendrakumar. Dr. N.Rajendrakumar is a practicing specialist doctor for the past 32 years. He is a consultant physician, cardiologist, diabetologist. He is the medical director of the Chandana Hospital at Bangalore. He has been practicing physician at Sharda Clinic, Bangalore. Dr. N.Rajendrakumar has worked into different departments of critical care unit and intensive care unit for several years. He has presented papers and participated in more than 400 national and international conferences. He has participated in 25 research studies. More than this, doctor has many accolades and credits to his record. Now, I would like to hand over the session to our distinguished speaker for today, Dr. Rekha Rajendrakumar.
Vaibhav? Vaibhav? How should I go now?
Just click on address hub.
Pardon? Can't hear.
Yeah, exactly below. You can see PPT. Just click on PPT.
Okay, fine. Okay, there is some disturbance there. Anyway, let me proceed. Thank you, organizers. Thank you, Mayor Pharma. And more than anything, thank you, participants, on taking time on this Sunday morning for listening to our talk. It will be a brief talk on proven efficacies of micronutrients through ages. Being a fertility specialist and gynecologist all these years, I would like to speak more on women issues. In the sense, why do we need micronutrients as women through all the age groups? Of course, the nutritional needs of a woman change with age. It's just common sense. As all of us know, young girl or toddler needs more energy because she'll be bubbling, she'll be doing lot of activities, unlike an old woman who is an octogenarian, where she needs less of nutritional needs and her calorie requirements are less. Why do we need these nutrients and micronutrients? What is the vital role of these important elements to our body? Why do we need them? Because in their absence or the deficiency of these micronutrients cause all the problems which I have displayed in this slide. The general problems can be the headache, palpitation, not able to sleep. We don't know the reason. Otherwise, she is physically very healthy, but she can't sleep. The stomach upset. So many things can happen where the proper diagnosis cannot be made because the physician thinks of the deficiency of these nutrients as last. And behavioral problems, unnecessarily she cries, mood swings do happen. Angry, suddenly she gets angry, and the smoking problems start. Sometimes they cannot avoid smoking. The social withdrawal, she doesn't want to mingle with family, she doesn't want to attend the social events. The emotional problems related to the same, like anxiety, depression, mood swings, irritability, she feels burnt out and she feels very insecure for no reason. They are vulnerable to hereditary diseases. Many diseases do appear. Example, carcinoma of the endometrium, carcinoma of the breast, the ovarian cancer. These are the cancers which are very hereditary. They run in families. So they become all the more vulnerable when they are nutritionally deficient. And there are flare-up of chronic diseases, maybe bowel diseases or lung diseases, some chronic diseases like autoimmune disorders, the inflammatory disorders of the joint. These are the chronic diseases which may flare up, which would have gone into suppression. Now, the nutrient groups, there are some important groups like, say, essential fatty acids. The next column in that shows that which are the ones that contain. Like the essential fatty acid is the primrose and the star flower oil, which is rich in gamma linoleic acid. Free radical fighters like beta carotene, selenium, vitamin E, C, etc. The essential vitamins and minerals, which are very, very essential for the body, like the whole range of B complex vitamins, which includes biotin, folic acid, the iron, zinc, chromium, copper, manganese, etc. In fact, yesterday I spoke on these nutrients, the micronutrients, but the topic was related to only infertility. But today it is over the span of so many years, that is throughout the age of the woman. Now, why do we need these micronutrients? Because they have got lot of important and vital function. The bearing of these vitamins ultimately keeps our physical and mental health in a good state. So it maintains the healthy hormonal balance in the body. As all of us know, there are a lot of hormones like a thyroid hormones, we call it as a TSH or adrenocortical hormones. There are so many hormones that orchestra of this hormone, that is the interrelationship between these hormones should be in a very cordial fashion, and the importance of the nutrients is there. This maintains the healthy hormonal balance ultimately. They relieve the premenstrual syndrome. Many women do come to us with lot of symptoms in a premenstrual phase. When they're about to get their menstruation, they get lot of symptoms, the bloating of the body, the mood disturbances, etc. So vitamins, especially the B6 vitamin, has an important role here. It is definitely necessary for the glowing skin or reduce the skin wrinkles, maintain the health of the skin, hair and nail. It is effective in mastalgia, that is a pain in the breast, which usually happens as one of the predominant symptoms of a premenstrual syndrome. Of course, it boosts the immune system. That is what I told in my previous slide, that the chronic inflammatory diseases do flare up in the absence of these nutrients. They reduce the oxidative stress. What is oxidative stress? I'm going to tell in my slides when they come in future. And they improve the antioxidant defense. Antioxidant defense is the good thing for the body. That is, it reduces the inflammation, it reduces the infection, it is the immune system, the immune booster of the body. Whereas the oxidative stress, or the what we call as ROS, reactive oxidative species, are the ones which are not good for the body, because they are what you call as poisonous to the cells. So it reduces the oxidative stress and it improves the antioxidant defense. So it makes everything good for our body. It improves the metabolism, reduces vulnerability to infection, of course repeated, minimize the chances of flare-up of chronic conditions and the genetic disorders. Now, this is an important and beautiful slide. I thought I should incorporate in my presentation. This slide is the one which says that over the years, you can see a red line and a blue line. Blue line says age more than 60 years, whereas the red one says the people, the statistics, the volume of people more than 80 years. Over the years, say the horizontal bar, the x-axis says that over the year, that is after the year 2000, the number of people, you can see the graph that the number of the statistics says that the volume of the people who are more than age 60 and 80 has increased, especially see the magnitude of people who are aged more than 60 years. Why I have put this slide is because the nutrients and micronutrients are definitely required for all the people, but all the more for these people who have crossed 60 and 80, since the magnitude or the the quantum of these people has increased over the age now for the past 10 to 15 years. These are the people who are the ones who suffer from the diseases, disabilities, the inflammations, or the malignancies. Malignancies means cancer. These are the ones who suffer from these problems much more compared to the younger age. So the micronutrients and the nutrients are all the more important, all the more necessary in this group of people. By the time, since I'm concentrating only on women, Dr. Rajendrakumar will speak on the importance of the nutrients for men. I will speak for the woman. By the time a woman is in her 50s, she probably cannot escape the fact that she is getting older. It creeps into her mind, and that is not good. Even if she does not want, it keeps coming on and off. Even if all the right steps to stay healthy have been taken, she was careful about her diet, she was careful about her exercise, and of course she was careful about her weight. In spite of that, the aging process creeps into the body and mind once she crosses 50. For many people, the years between 50 to 59 bring a number of changes, success, achievements, accolades, challenges, family problems. So many keep coming. Common problems that are faced after 50 years of the age are the menopause. The osteopenia means the weakening of the bones. The bones do lose their strength as they were before. They are not as they were before. The bones become weak. The calcium inside the bone is reduced. The bone gets resorbed, and chances of fractures are more because of that. The cardiac problems, the heart problems are more. Chances of coronary artery disease, atherosclerosis, high blood pressure, the mood swings. Of course, the vision also becomes weak. The retinal sensitivity reduces. Maybe that is one problem, or the cataract is another one that creeps in. The skin problems like the adult acne, sun damage, age spots, wrinkles, dry skin, and whatnot. Thyroid problems can emerge. The cognitive disorders, in the sense the perception disorders, not able to perceive, she's not as sharp as she was before 50, mentally and physically. Now, this is a slide. I have briefed about this part in my previous slide. Here, what I want to highlight is this is a seesaw between the antioxidants and free radicals. If the antioxidants are more in our body, maybe because we have taken the nutrients and nutritional supplements, antioxidants have become are in a good quantity in our body, the free radicals come down. Free radicals are not the good ones for the body, as I have already told. These are the damaging ones. These are the ones, they are not good for the cells. These are the ones that cause the DNA damage. These are the ones which are carcinogenic, or the ones which produce the cancer, because the chromatin or the DNA structure in the cells goes haywire. So because of this, the accumulation of the free radicals causes lot of problems and hastens the aging process in the body. So we do not want this free radical, or the ROS, reactive oxidative species. The antioxidant neutralizes or kills the free radicals. So the nutrients do contain, or they are rich in antioxidant. So the oxidative damage causes the tissue injury on one arm and the inflammation on the other arm. So the imbalance between the production of the free radicals and body's ability to neutralize. This neutralization is very important. Once the free radicals are neutralized, the body becomes healthier. Now, why I'm emphasizing on free radicals again and again? Because this causes impact, the negative impact on many target organs of the body. See, this slide says it causes problem in the brain, it is not good for the heart, it damages the kidney. So each organ is ultimately targeted once the free radicals or the ROS gets accumulated in the body. The lung, it causes asthma, chronic pulmonary diseases, allergy, chronic bronchitis, and chances of cancer is much more in any organ of the body. So this slide highlights, in one slide, I have put all the things together as a summary. So, why do we need the micronutrients? Postmenopausal stress, anxiety, depression, that is the mood swings, of course the skin problems, as a nutrient supplement for the general well-being itself. Even if you are fine, you don't have the mood swings, you do not have the skin problems, you are perfectly okay with coronary vascular diseases, you run 10 kilometers a day, everything is fine. But in spite of that, we do need a nutritional supplement, because we have to have the proper maintenance of our body. For the wear and tear of the body, we do need these nutritional supplements. It's, if not for anything, it's just for the general well-being we do need, because our nutrition is not sufficient in all the ways, especially the present day farming. Thanks to the present day farming, where our soil is not rich in the enough nutrients, unlike the decades back. It is all a lot of the soil is full of contamination. It is depleted because it is lot of chemicals are added to the soil, and even the meat eaters do get all a lot of fortification in the meat with lot of chemicals, and even the milk from the cow to get a better yield, lot of hormones are added. So ultimately, I feel our present day nutrient is with lot of contamination, and ultimately it is not a healthy supplement what we are getting. So to get this, to bridge the gap between what we are today, in the sense what we are consuming and what we are supposed to take ideally, in between, to bridge the gap, we do need these nutritional supplements. This is what I feel. Now, what are those? Why I am telling about this, where vitamins, minerals, nutrients, etc. What are these key factors? Vitamin B complex. What are the role of these vitamins and the nutrients? Vitamin B complex regulates the cholesterol levels, hormone production, and it helps to maintain the homocysteine level. What is this homocysteine? Homocysteine is a key element in the body. We are not happy with this element because we have to maintain the homocysteine level at a very, very low level. Hyperhomocysteinemia is the condition where the level of the homocysteine in the body is increased. It is a very detrimental state for the body. Lot of problems do happen in women. The aging process is increased. The women of the marriage age group, or those who are in the fertile fertile age group can get converted to infertility status, or the chances of coronary artery disease, or what we call as a heart attack, myocardial ischemia, is much more when there is a hyperhomocysteinemic state. Many of people you would have heard, a youngster who was very healthy, a fitness freak, suddenly died because of coronary artery disease, maybe because of hyperhomocysteine level, because it is the neglected part, and many doctors do not check the homocysteine level in the body. So what I want to say is the homocysteine level has to be kept under check. It has to be at a very low level. Now the folic acid is another one which is an antagonist of homocysteine. The folic acid, the more folic acid is in the body, either by your diet or by your supplement intake, it checks the homocysteine level. It keeps homocysteine level at bay. It helps to prevent the clogged arteries by keeping down the levels homocysteine. This is what another journal says. Biotin, another important vital vitamin, it regulates the blood glucose level and the insulin, and it is recommended to reduce the triglyceride levels. All of us know that the blood glucose level has to be very much under control, because hyperglycemic state is not good for the body. That is toxic to all kinds of cells in the body. What does vitamin do? Vitamin D do? Vitamin D is an emerging regulator of uterine leiomyoma. What I want to say is a journal, Caspian Journal of Internal Medicine, says that the growths, that is the benign growths in the uterus, may be because of deficiency in vitamin D. What you would have heard of what is called as a fibroid in the uterus, very common problem. About 30 to 40% of women in the reproductive age group do show or do suffer from the problems related to the uterine fibroids. It is said that vitamin D is one important factor which keeps these uterine leiomyoma or the uterine fibroids under check. Vitamin D supplementation would have the potentiality to become a regular, simple and economic means to prevent this fibroid development. Zinc is another important one that boosts the immune system, as all of us know. Zinc is important for fertility. Zinc is important to maintain the immune system. It is a very important element, micronutrient rather, which reduces the depression, irritability and tiredness because it acts on the neurons and the neurotransmitters of the brain. Vitamin B6 and magnesium, of course, they are very important, and they reduce the premenstrual symptoms, as I have already told. What are these antioxidants? These antioxidants control the auto-oxidation. This auto-oxidation happens in the cells that is not good for the cell. It damages the cells. So these are the antioxidants which prevent or which keep the auto-oxidation under check by interrupting the propagation or by inhibiting the formation of free radicals. I have been telling throughout that these free radicals are not good. They are the ones which damage the cells, and they are detrimental to the ultimately for the health of the cell. And the antioxidants thus reduce the oxidative stress, they improve the immune function and increase the healthy longevity. I am sorry that certain facts do appear repeatedly. I may be repeating, but I want to quote and give respect to these journals because they have done intense studies, and I'm quoting from these journals, so some points do repeat. I'm sorry for that. Vitamin A and beta carotene are essential for the normal growth and development, of course the immune function, and all of us know that these colored fruits and colored vegetables what we eat are very important to improve the vision because they are rich in vitamin A and beta carotene. Beta carotene plays a role in reducing the risk of heart attacks. Vitamin C is very important, present in great amounts, in abundance in citrus fruits, that is used for improving the endometrial thickness, that is the inner wall of the uterus, to maintain the health of the endometrium. It is required for the synthesis of collagen. Collagen present in all parts of the body, especially for the joints, to prevent the osteoarthritis or reduce the rate of progression of this osteoarthritis. Vitamin C is very important. For the synthesis of steroids and peptide hormones, it is important. It protects the tissues from oxidative damage again. The deficiency is linked to the heart disease and mild cognitive impairment also. Selenium, another one. This is incorporated into proteins to make the selenoproteins. So it's an important antioxidant enzyme. Selenoproteins prevent the cellular damage again. Selenoproteins regulate the thyroid function. Many of us, our patients, especially the women, thyroid problem is very, very rampant, very common. It is unfortunately or fortunately, it is totally asymptomatic until and unless it is in a bigger magnitude. Until and unless the patient has the TSH to a greater extent, she is totally asymptomatic. She does not know that she is suffering from the thyroid problem, and there will be a lot of symptoms which cannot be attributed to any particular problem. She'll be suffering from loss of sleep or hair loss or putting on weight, skin has lost luster, so many things, but nobody would have checked her thyroid function, the hormone TSH, and it may be because of, again, the deficiency of these nutrients. Improvement of the quality of life and eye involvement, as well as delayed progression of ocular disorders and immune systems, are attributable to the selenoproteins. Bioflavonoids. The isoflavones or the bioflavonoids, are very, very important to boost the immune system, especially in the postmenopausal age group. Woman has crossed 50, has lot of symptoms, maybe because of this absence of this bioflavonoids. Dietary flavonoids, they are available in soya. Soya bean is a rich source of bioflavonoids. Dietary bioflavonoids are, as they are used as cancer chemopreventive agents. They have a promising effect in preventing the postmenopausal bone loss in women. Bone loss is very much known in the postmenopausal women, especially the maximum steep fall is the early menopause. In the sense, the Indian average is around 53 to 55 years, the woman achieves menopause. So it is from, say, 53 to 60, the early part of the menopause. As soon as she has reached menopause, unfortunately, the bone resorption is at its maximum. So the bioflavonoids counteract this problem. It improved cardiovascular outcomes and improvement of the immune function is known with supplementation of these bioflavonoids. They also protect the blood capillaries and maintain the health of the blood capillaries, and the blood vessels are maintained as a young girl. The vitamin E is an antioxidant which plays a role in lowering the cholesterol, and it acts as an anti-cancer agent. Probably all of you do know. Therapeutic potential of the antioxidant compound as a co-adjuvant treatment to conventional antidepressants should be considered according to a journal which talks about the CNS drugs, that is the central nervous system drugs. Vitamin D plays an important role in bone metabolism. It is not only in women of postmenopausal or the woman who has crossed 40, even in a toddler, even in a newborn, vitamin D has to be in the body in enough quantity, otherwise they get the what all of you have heard called as rickets, where the bones are not healthy, the height of that child reduces, there is a resorption of the bone and bones are weak. It causes the modulation of the innate and the adaptive immune function. So ultimately all these vitamins and the micronutrients boost our immune system. Say in the present era of corona, the immunity has to be improved. The person who has a good immunity, even if becomes corona positive, survives this battle. Why? Because her or his immunity is in a good fashion. The person, whether irrespective of the age, youngster or a person who has crossed 70, suppose the immune system is not in a proper fashion, the immunity is weak, he cannot conquer the corona. This is in the present corona era, but even otherwise, for to conquer or battle against any of the infection, the key word is boost your immunity. So vitamin D is cardioprotective also, and it enhances the insulin sensitivity. What does it mean? Enhances insulin sensitivity means the chances of getting diabetes is much less. Means it controls the blood sugar and keeps blood sugar under check. The sugar in the blood should not be high. Of course, there are values, it is out of the purview of this topic, but the insulin sensitivity improves, means insulin keeps the blood sugar under check. Iron, another important thing, requirement for the iron for women, especially because they lose blood during the menstrual period every month. So the requirement for the iron for women change after menopause, because they go into a state of what is called as amenorrhea or stop menstruation. The need for iron to replace the menstrual losses ceases. This is what I was telling. And tissue stores are generally adequate if dietary intake is at acceptable levels. If she takes care of her diet with a good amount of green vegetables, fruits, and lot of fiber in her diet, the iron will be maintained, and extra supplement as a drug is not necessary in the postmenopausal state in many of them. Needs for iron in older women revert to the same levels as those for adult males, that is, a need per day is a 10 milligram. In a woman who is premenopausal, who is menstruating every month, it goes up to 30 milligrams per day. Micronutrients help in lowering the homocysteine level, which I have already told, I don't want to repeat. Vitamin D and B complex maintains the bone mineral density, of course, and reduces the risk of fractures, especially in the context of postmenopausal women. You would have seen many women walking down the stairs or walking in the ramp, not holding the some support, and they've fallen, and a trivial fall would have given rise to a hip fracture or the spine fracture, that's a vertebral fracture, etc. That is because of vitamin D deficiency, because the calcium is reduced in the bone and bone has got resorbed. Alpha lipoic acid maintains the cognitive functioning, very, very important for the cognitive functioning, memory, etc. Vitamin A, E, lutein esters enhance the retinal sensitivity. We have to have a good retinal sensitivity and cognition. That is very important in patients with age-related macular degeneration. Macular degeneration reduces the vision, and vitamin A, E, and lutein esters are very important to prevent or counter that problem. Bioflavonoids provide antiviral, anti-inflammatory, and anti-allergy properties also. That is very, very important, say in patients who have bronchitis or respiratory allergy. Selenium is incorporated into proteins to make selenoproteins, important antioxidant. Selenoproteins also help to regulate the thyroid function, already told, and play a vital role in immune system. Major depression has been associated with lesser concentration of endogenous antioxidant compounds. Already I have repeated probably. And it is with an impairment of total antioxidant status, the problem is much more. Vitamin E has shown some effectiveness in relieving hot flushes in postmenopausal women. Okay, coming on to this, the postmenopausal women, especially in the beginning of the menopause, she has just entered into menopause. As I said, age of 50 to 60, they do complain of hot flushes. Many of them do complain. It's an important and a prominent symptom, and they're very much disturbed because of this. They keep complaining because it disturbs their day-to-day activities. Suddenly, there is a flush of, as though she's sitting in front of the oven. Then suddenly it becomes so cold. She switches on the fan, then it becomes so cold that she wants to switch off the fan. So there is a lot of, she feels lot of changes in the swinging temperature. This is what she feels. One time it is a real hot flush, unbearable hot flush, and suddenly it becomes very, very cold. That is very disturbing, isn't it? The role of vitamin C is that of an antioxidant. As a metabolic reducing agent, it is needed for collagen production, which is essential to make new tissue. We want the regeneration coming up of the new tissues because there is a degeneration or disintegration of the old tissue. If we fall, the wound should get healed. If we fall, the blood that flows from the wound should stop, and there should be a regeneration of the new tissue as the old tissue gets degraded and degenerated from the body. So it is important for the maintenance of the development of the new tissues, and also very important for the vascular integrity, that is the health of the blood vessels. Coming to the fats and fatty acids, there are two important groups, saturated and unsaturated. Unsaturated fatty acids are the healthier ones, and they are the ones which should be in abundance in our body. Out of that, again, there are two groups, as I have shown here. The polyunsaturated, what we call as a PUFA, polyunsaturated fatty acid. These are the ones which are very divine or very important for us, and anyone has to have rich quantity of PUFA in our body. Among PUFA, we have omega-3 and omega-6. Vegetarians can bank on corn oil or sunflower oil, even flaxseed. Nowadays, everybody speaks of flaxseed. That is very, very important. Flaxseed can be used in any form. You can roast the flaxseed and put it in mixie, make powder, and add it to the dough you make in chapati. So that way the flaxseed can be consumed. Soybean is very good, walnut and rapeseed oils. The omega-9 fatty acids also okay, better than saturated fats. Coming to the essential fatty acids, EFA has shown its therapeutic potential for premenstrual symptoms, mastalgia, hot flushes, gestational diabetes, that is the diabetes that comes in pregnancy after 24 weeks or 6 months of pregnancy, and also important to ripen the cervix, that is the path where the baby comes. The EFA has shown a beneficial effect on dysmenorrhea, that is a painful menstruation, and PMS. It helps to relieve PMS according to one more journal on reproductive health. First and second line of treatment of cyclic and non-cyclic myalgia, of course, and mastalgia. Gamma linoleic acid helps in improving, it's an immune booster. Atopic dermatitis and psoriasis are the skin disorders which do need EFA and star flower oil. Oxidative stress and inflammation are the causative factors in atopic dermatitis. There is inflammation of the skin. These two are the skin disorders. So the antioxidants along with gamma linoleic acid and vitamin D reduce the oxidative stress, and they put the atopic dermatitis and psoriasis under control. Endometriosis is the disorder of the uterus, ovaries. It is the disorder of the pelvic organs. Women with endometriosis have increased oxidative stress. There is inflammation in and around the uterus, in and around the ovaries, in the pouch of Douglas and peritoneal cavity. So all this inflammation is taken care of by these antioxidants, because it takes care of all the chronic pelvic inflammatory disorders. This is again about use of gamma linoleic acid, vitamin B6, magnesium, etc. So what these things do in case of premenstrual syndrome? Mastalgia is women who get pain in the breast. Most of the times it is before the menstruation. So according to textbook of Martindale and Therapeutic Drugs, also the NHS breast screening programs of UK guidelines, it is recommended, that is the use of EFA, especially the gamma linoleic acid, is very helpful in putting mastalgia under control. Coming to one more point here, this is OC, means the oral contraceptives. These are the family planning drugs. When the woman takes these OCs, that is oral contraceptives, for many months or years together, some people do need it for years together, the nutritional deficiency is known because of chronic consumption of oral contraceptives. In these women, again, the use of antioxidants is helpful in ameliorating the symptoms or the consequences which are secondary to the OC use. Coming to the green tea extracts, it contains the polyphenolic compounds, are also known as epicatechins, which are antioxidants. So green tea extract is rich in antioxidants, and it is helpful in controlling the cancer, especially the breast cancer. It is a potent antioxidant. That is what I was telling. The epicatechin is a potent antioxidant, anti-inflammatory, anti-carcinogenic, and of course it boosts the immunity. The blood vessels, the cardia and the blood vessels are maintained healthy. So the consequences of the problems of the cardiovascular problems like the myocardial infarction or the problems of damage of blood vessels in the brain resulting in stroke or all are reduced if one consumes green tea extract. Alpha lipoic acid has anti-aging and skin protective effects. Alpha lipoic acid also improves the insulin resistance and controls the diabetes. Thus, ALA might be useful agent in the management of chemo prevention, especially the obesity-related cancers like uterine cancer, the breast cancer. Alpha lipoic acid is used for age-associated cardiovascular, cognitive, neuromuscular deficits and whatnot, because they mainly maintain the endothelium. The endothelium is the one that is the innermost layer of the blood vessel. It maintains the health of the blood vessels. So it reduces the oxidative stress, and thus the blood vessels are healthy, be it heart or the brain. ALA is essential cofactor of mitochondrial multi-enzyme complex. We know this mitochondria is the energy storehouse of each cell. So it is important cofactor of the mitochondria. It boosts the mitochondrial working efficiency. It plays an important role in energy metabolism. Therefore, ALA is pleiotropic compound with a potential therapeutic use in diabetes. Again, I'm repeating, alpha lipoic acid has anti-aging and skin protective effects because of all these positive effects. Lutein esters, carotenoids, especially the beta carotene in the serum, was associated with reduced level of depression symptoms. It is strongly implicated as being protective against age-related macular degeneration. Macular degeneration causes the diminution of vision. So it helps to, that is what I was telling, the beta carotene and vitamin A are very important to maintain good vision, and also it reduces the incidence of cataract. Lutein esters enhance the retinal sensitivity in patients with age-related AMD. L-carnitine, another important nutrient, probably neglected one. It improves the weight loss. It hastens the weight loss. It controls the glycemic status. It improves the muscle function. It improves the contractility of muscles. The person with dilated cardiomyopathy, where the heart ejection fraction is reduced, say to reduce 20%, 30%, do need L-carnitine because the heart pumps better, because the myometrial contractility or the heart muscle contractile capacity is increased because of L-carnitine replacement. Oral L-carnitine is capable of reversing the hyperthyroid symptoms. Thyroid function has increased. That is also not good. Like hypothyroidism also is not good. So the oral L-carnitine keeps the TSH under check. L-carnitine is efficacious in improving the depression symptoms, and it improves the quality of life in cases where the patients are very much incapacitated because of muscle pain. Phosphatidylcholine is another important component to maintain the biological membrane. Each cell has a membrane, and the health of these membranes is maintained by phosphatidylcholine. It helps in slowing down the aging process because it maintains the cell membrane. It improves the brain function and memory capacity. Isoflavones, already told probably, it is rich in phytoestrogens and it's a plant-derived compound with estrogenic activity. It replaces replaces the estrogen in a very physiological and biological way. It is not considered as a drug. It is considered more as a food supplement, and it has to be used in women who are menopausal, perimenopausal, or postmenopausal. As I have already told, the soya beans and soya products are the richest source of isoflavones. So thus, as a estrogen replacing compound, it maintains the cardiovascular state, it prevents the osteoporosis or the bone loss, and it keeps the hormone dependent cancers under check, and also it reduces the loss of cognitive function. So isoflavones inhibit the tyrosine kinases and other enzymes that are involved in tumor growth, so that keeps the tumor growth also under check. As all of us know that cancers, any cancer, especially the breast, the endometrial or the ovarian cancers, that is the female related cancers, are much more, the incidence is more in the postmenopausal women. So the use of isoflavonoids reduces the chance of breast cancer. It inhibits the angiogenesis, that is the unnecessary multiplication of unwanted blood vessels. It stimulates the sex hormone binding globulin production and decreases the level of free and active hormone that is in the blood, that is very necessary. Any hormone is better if it is attached to the SHBG. It protects the DNA from damage. As I was telling, that DNA structure goes haywire when there is damage in DNA, and so isoflavonoids help to maintain the health of DNA. These slides are repeated, but I just wanted to tell that so much of work has gone behind this, and so many of the journals have done so much of research and shown us the fact and the consolidated fact that isoflavones reduce the risk of breast cancer. This slide also depicts the same. So the conclusion is soy isoflavones consumption reduces the risk of cancer recurrence in women receiving tamoxifen therapy. Those women who are already taking, those who are already a case of breast cancer, already taking treatment like tamoxifen therapy, are also supposed to use soy isoflavones. So dietary intake of soy isoflavones was associated with lower risk of recurrence among postmenopausal patients with breast cancer. The recurrence also of the breast cancer reduced because they took soy isoflavones. Now this is homocysteine I had touched upon in my previous slide. High homocysteine level, which is not good for the body, which is damaging and detrimental to the body. The high homocysteine levels were associated with a higher bone turnover. That is, resorption of the bone was more in these people. There is a poor physical performance in them and lower bone mineral density. There was no clear association to fracture risk though. The increased mortality among women, not only women, anybody rather, with high homocysteine levels indicates that a high homocysteine level may be a marker of frailty. Myoinositol, one more compound, it acts as an insulin sensitizing agent to promote the proper utilization of insulin. Myoinositol is closely related to blood insulin levels. It counters the blood glucose level. It reduces the blood glucose level, increases the insulin sensitization. It supports the proper hormone balance, ovarian function in women with PCOS, that is polycystic ovarian syndrome. You ask any girl in this present jamana, they say I have PCOS. So it keeps the quality of egg. It checks the quality of egg. It maintains the egg quality. The menstrual cycle regularity is also maintained once the woman is on myoinositol. Many women of PCOS do need their interest is fertility, but many women do need only the regularization of their menstrual cycle. They are not interested in fertility, either a young adolescent girl or the one woman who has finished her family. So either of the groups, they do need myoinositol because it maintains the menstrual cycle regularity, as well as it keeps the PCOS under check and thus maintains the fertility and boosts the fertility. The ovary, the eggs that are coming out of the ovary become much healthier once the myoinositol is supplemented. Myoinositol and nicotinamide help in lowering the serum LDL levels, the bad cholesterol, thereby preventing the coronary vascular complications. Hair growth. Many girls do come with a lot of hair issues. They have a lot of complaints, either hair fall or there is a breakage of hair, the color and the luster of the hair is gone. So many complaints. So again, the nutrients, the micronutrients, the minerals and vitamins, amino acids, which I mentioned all this while, have a vital role, a supporting role, a positive role in hair growth. Because what happens is the collagen disappears with age, causing the hair follicle stem cells. There's something called stem cells in the hair follicle, and that gets damaged over the age. The collagen gets disintegrated and gets depleted. Because of that, the root of the hair gets weaker. Once the collagen is gone, the hair root is weak. Definitely the hair fall is more. So the woman loses the collagen faster than men. Also, the body's ability to produce the collagen decreases after a certain mid-age. So again, the nutritional supplement counteract this problem. So where do we need hair growth? As I have already told, sometime maybe nutritional hair loss. She might have had a bigger health issue come out of a chronic illness, or might have received chemotherapy in the recent past, might have had a very morbid state. All this case, the hair fall is in a very fast pace. So these women do lose hair to a very great extent and very fast. So these people, and sometimes post-pregnancy hair fall, sometimes around menopause, or even the premature graying of hair can be counteracted by the use of these nutrients. Coming to the last one or two slides of my presentation, what I would like to say is just a summary rather. Why do we need an ideal supplement? Because they are the rich source of micronutrients which our body definitely needs. They offer excellent result in the treatment of premenstrual syndrome and stress related symptoms. The specific nutrients help in correcting the root cause of PMS. The body they contain lot of multivitamins which the body does need. The patient compliance is better. Our performance is better either in the house or outside. As our professionals, our performance will be much better. We don't complain of fatigue and weakness all the time. We don't get tired. When we do exercise, a lot of nutrients are required, because that drains our energy. It keeps us physically active and mentally alert. Ultimately, the health and vitality and the whole day stamina is maintained. So again, it reduces the age-related risk. This is just a summary of all what I have told. Like bone strength, muscle strength is maintained, the hair fall is reduced, cardiovascular diseases are reduced, cognitive impairment is reduced, our memory is better, and the very, very important, because the incidence of cancer has grown by leaps and bounds nowadays. So nutrients, the bioflavonoids, the vitamin A and E all help us to reduce the risk of cancer, because it is proven that they have anti-aging properties. Thank you all for your patient listening. I know that I have taken a lot of your time. Now I hand over to Dr. Rajendrakumar for his presentation. Thank you for the patient listening, the participants. Hello? Hello?
Yes, ma'am.
Yeah, I have finished with my presentation.
Thank
Do
you,
you
ma'am.
have an interaction session?
Yes, ma'am. We already have a first question from our attendee. So, should we take it now or?
Yeah, is that okay? Or if it is too late, you can go to Rajendra Kumar's presentation.
Yes, sir. So, ma'am, we'll continue with sir's presentation, and post that
Fine.
we'll consider a Q&A session for that.
All right, all right. Is that visible? Is the screen visible?
Yes, ma'am, it is visible.
Okay,
Only
fine. Yeah.
yes.
Right. Yes.
Start. Good afternoon, everybody. I'm Dr. Rekha, physician. Today,
Am I audible?
we'll talk about nutritional factors in male.
Is he audible?
Yes,
Am
ma'am,
I
he is
audible?
audible. Yes, sir.
Okay, good. Thank you. And anyway, the detailed nutritional aspects has been told by previous speaker, Dr. Rekha, made my job very easy. I will go to only the practicality about nutrients and trace elements, minerals, etc., rather than elaborating on this in detail. Nutrients are substances that are not synthesized in sufficient amount in the body and therefore must be supplemented by the diet. If the diet is poor, then by drugs. Don't think drugs is only to treat diseases. And remember, diseases are not, health is not absence of disease. Health is a positive health where there is a physical, psychological, and spiritual health also. So, to prevent diseases, so we need to take care about our nutrition. In fact, recently I had a couple very learned people, probably IT industry, they Google, they eat well, good product, good food, everything. They came to me with so many symptoms of neuropathy, memory loss, and not able to work to their potentiality, etc. So when we started interrogating with them, they knew most of the factors about nutrition more than me. But when we checked, there are a lot of nutrition deficiency in them. They were surprised. But the reason is one, the nutritive value of the agricultural product what we get is very low of late, maybe about decade or two, and without any major clinical symptom, they may have nutritional deficiency. So we need to supplement with that, and don't think that you are taking some drug if you supplement all these nutrients, but try to maintain it properly for the positive health. The absence of essential nutrients leads to growth impairment, especially in children, organ dysfunction, failure to maintain nitrogen balance, this is most important for energy production, or adequate state of protein and other nutrients. For good health, we require energy, which is derived from carbohydrate, fat, and protein, vitamins, minerals, trace elements, and most important is water. Requirements for organic nutrients, there are 9 essential amino acids. I will not go to the details in primary biochemical class. Then several fatty acids, and usually they have a taboo that if there anything said about fat, they feel offended. They are scared, but need not to be. Glucose, 4 fat-soluble vitamins, 10 water-soluble vitamins, dietary fiber, most important, and choline. Several inorganic substances, 4 minerals, 7 trace minerals or elements, 3 electrolytes, and ultra trace elements. So usually the amount of these nutrients required differs by in their age, physiological status. So they require to take adequate nutrition and also check their nutrients and supplement with drugs. So my topic is men are constantly facing challenges in daily life. I'll be unfair if I say only men. Women are also facing. Common concern for today compromises overall well-being is increasing work pressure. Of course, everybody is putting a lot of effort in their work. Unhealthy diet. When you are at work, you don't eat healthy food. Stressful job, of course, in the present scenario. Hectic lifestyle and busy social life. Everybody is in social life. So life's challenges, harmful habits, leads to chronic fatigue syndrome, and you might have observed they end up with recurrent infections, recurrent illness, chronic illness. Lot of people come with stress symptoms, and if they, as I told you previously, poor nutritional status. And there is a proverb in Canada. It's very apt in this situation. ಊಟ ಬಲ್ಲವರಿಗೆ ರೋಗವಿಲ್ಲ. That means if somebody knows how to eat, when to eat, and what to eat, they don't suffer from diseases or a positive health. Now the energy, if weight remains constant, weight will remain constant if the energy intake and energy expenditure, if they match together. There is something known as resting energy expenditure. When you are at rest, you are going to spend energy, and with physical activity, you are going to increase in the spending of energy. So average energy intake is around 2,600 calories for men, 1,800 for women, and formula for estimating resting energy expenditure: 900 plus 10 into M. M is mass in kg for male, and for female 700 plus 7 into kgs. So it should be adjusted to physical activity. If you are physically active, 1.2, 1.4, 1.8, moderate active and very active. Estimated energy requirement is the total calorie needs in a state of energy balance of a person of certain age, sex, weight, height, physical activity, etc. Now, most important is protein, essential amino acid, non-essential amino acid for protein synthesis. For adult, we call it as recommended daily allowance, RDA, is around 0.8 grams per kg per day. And it should be around 10 to 14% of the calorie intake. In all these conditions, our body depletes its store of nutrients and reduces the ability to overcome the stress and fatigue. Now, what are these things? Is already been told. Vital antioxidants are beta-carotene, is a pro-vitamin A, vitamin C, vitamin E, selenium. Micronutrients, zinc, most important in the present scenario, biotin, folic acid, B6 and B12. L-arginine, methionine, essential amino acid, and ginseng is an additional benefit, the Korean root. Vital antioxidants are beta-carotene, protect from free radical damage and reduces the risk of coronary vascular disease. Most important, bioflavonoids, underestimated, possesses anti-inflammatory, antibacterial property and boost immune system functioning. So the bioflavonoids in the vegetable and fruit gives odor, it gives color, it gives taste to the food. Most important, if you take more vegetables, more fruits, around 100 grams of fruit per day, they say around 6 servings, may not be possible, around 4 servings per day. And vegetables around 400 grams. It gives adequate bioflavonoids which possesses anti-inflammatory. It also acts as antiviral, antibacterial, and it improves your innate immunity, your own immunity. And you can fight against the infection. Vitamin E and C are potent antioxidant and reduces the stress level. Vitamin C is available in citrus fruits and green leaf vegetables. Essential micronutrients, vitamin B complex, promotes prostate health, regulate cholesterol level, hormone function, male glandular functioning. Biotin, there's not much of research in biotin. Regulate blood glucose, insulin also helpful to reduce triglyceride level. Zinc is most important, promotes and maintains prostate function, sperm production, boost immune response. Magnesium promotes muscle structure, maintains bone health. L-arginine is an essential amino acid, stimulate the production of nitric oxide, which support vasodilatation, improves the blood circulation, improves the peripheral hepatic insulin sensitivity. Insulin action will be potentiated, enhances the immune function. Almost all of them enhances the immune function. And that's the only way you can fight against the viral infection around, more so the present COVID. Reduces L-methionine, reduces the oxidative stress, essential for production of carnitine, which is essential for proper functioning of muscle, reduces oxidative stress. Something about ginseng, maintains good glycemic control, enhances body ability to cope with external stresses, provides relief from chronic fatigue syndrome, increases the immune system function and known to restore vitality. Now let me see what are the therapeutic rationale of prescribing antioxidant and micronutrient. Reduces oxidative stress so that the damage to the internal organs are reduced. Boost immunity, reduces homocysteine level, as already told. Hyperhomocysteine may be one of the reason for sudden cardiac death, coronary vascular disease in young. But there is no proven efficacy or proven cause and effective ratio so far. But I think that's more important. We have to reduce the homocysteine level by giving vitamin B complex, folic acid, and niacin. Amino acid essential, stimulate production of nitric oxide, which support vasodilatation, reduce oxidative stress. And ginseng provide relief from chronic fatigue syndrome, act as a hypotensive, lower serum triglyceride, and increases HDL, which cannot be done with other lipid lowering agents. So again, in summary, ginseng improves blood circulation, vasodilatory activity, arginine improves peripheral and hepatic insulin action, methionine breaks down fat and prevents their buildup in the liver and arteries, vitamin C, vitamin E are powerful antioxidant which reduces stress level, usually indicated in recovering from a viral infection, hectic lifestyles, athletes and sportsmen. India is slowly getting into a Western world in the sense the aged population is increasing. If you see this graph, age above 60 years, age above 80 years, from 1950 till date, it is slowly increasing. So aging is better health across the life, of course, can reduce the disease and disability. We have to take care about the aged people. Early life growth and development, adult life maintaining the highest possible level of function, older age maintaining the independence, preventing fall and disability. So this is a very crowded slide, but the nutshell is you have to improve the homeostasis, antioxidant and other factors in lifestyle, improve the innate or our own immunity by impaired all these chronic oxidative stress, we have to reduce it. Immune function, vitamin C, vitamin D, and zinc have immune enhancing and immune modulating properties and play a synergistic role in supporting components of both innate and adaptive immunity, which compromise epithelial barriers, cellular defense, antibodies constituting the three main lines of immune defense. Adequate intake of vitamin B6, folate, B12, C, E, and of selenium, zinc, and copper and iron supports Th1 cytokine mediated immune response with sufficient production of pro-inflammatory cytokines, which maintains an effective immune response. Micronutrients with antioxidant capabilities decrease the risk of age-related mental deficiency. Macular degeneration is a degenerative process of the macula and is the principal cause of blindness among people aged 65 and older. Prevalence rate of age-related macular degeneration in patients with a low antioxidant intake and low lutein intake was about twice as higher than in patients with higher intake. Lutein esters. Several studies have shown that high lutein intake, either through diet or as a nutritional supplement, has beneficial effects on eye diseases, preventing from AMD. Recently, a number of studies have suggested that lutein may indeed have a favorable effects via anti-inflammatory activity, improving cognitive function, and decreasing the risk of cancer, cardiovascular disease, and other systemic conditions. This one small study, randomized, placebo-controlled clinical trials of high-dose supplementation of vitamin C, E, beta-carotene, vitamin A, and zinc, and age-related macular degeneration, vision loss. So, as I told you, prevalence of hyperhomocystinemia in elderly population older than 65 is as high as 30%. And homocysteine and age-related problems or vascular disease, like several meta-analyses concluded that homocysteine is an independent risk factor for coronary vascular disease, cerebrovascular disease, peripheral arterial disease. Majority of these studies have conducted in middle-aged individuals. And these people are more prone for stroke. Even young stroke, we tend to investigate for homocysteine. There is no recommendation, but we do find if you reduce the homocysteine level, possibly we do good to patient. Cognitive impairment, homocysteine is proposed as a neurotoxin. Homocysteine exhibits angiotoxicity, leads to large or small vessel disease in the brain, eventually causing cognitive impairment, dementia, depression, and decreased physical function. If you reduce serum homocysteine level after micronutrient supplementation, it reduces significantly after 6 months of supplementation. You can prevent all these problems like cognitive dysfunction, coronary vascular disease, cerebrovascular disease, and depression, etc. Multivitamin supplements increased cognitive function and decreased serum homocysteine level and depression. A Korean study. Age-dependent levels of plasma homocysteine and cognitive performance. Folic acid, vitamin B12 intervention in people with elevated homocysteine levels in India could prove effective in lowering homocysteine level and help maintain or improve cognitive function. So antioxidant intake and cognitive function of elderly male. High antioxidant intake from food and supplement source of vitamin C, vitamin E, and carotene may delay cognitive decline in the elderly. That's the major issues in elderly population. Now, the most important vitamin D, it's not a vitamin, it's a hormone. You can get the vitamin D by two sources. One is exposing yourself to ultraviolet radiation from the sunlight, and the second is dietary consumption of milk and milk product. Vitamin D deficiency is very rampant in India, which is associated with sarcopenia, that is low muscle mass, and which is a reason or one of the reasons for type 2 diabetes and complications. So vitamin D level should be maintained by exposing ourselves to sunlight. And we Indians, very unfortunate that our skin is brown, the UV radiation will not penetrate. And second thing is there is an enzymatic problem beneath the skin where dehydrocholesterol is not converted to active form 25 hydroxy cholecalciferol. So we need to take a supplement vitamin D from outside. So again, homocysteine levels, if is low, corticeps strength, gait, speed, late life disability in older people can be prevented. Now the carotenoids as a protection against disability in older people, higher total plasma carotenoid were associated with significantly lower risk of developing severe walking disability or associated with less steep decline in 4-meter walking speed over 6-year follow-up, with a lower incident rate of being unable to successfully complete 400 meters test at the end of 6 years. Antioxidant and physical performance in elderly person, the study, low total plasma carotenoids are independent predictor of mortality or morbidity in older persons. Effect of micronutrients supplementation on quality of life and left ventricular function in elderly. 30 congestive heart failure patients, an average age of 75.4, were randomized to receive capsules containing a combination of micronutrients, calcium, magnesium, zinc, copper, selenium, vitamin A, thiamine, riboflavin, vitamin B6, folate, whole lot of things, and a placebo for 6 months in a double-blind fashion. Long-term conclusion is long-term multiple micronutrient supplementation can improve left ventricular function, left ventricular ejection fraction, their quality of life is restored, they don't have breathlessness, orthopnea, PND, with elderly patient with heart failure due to left ventricular systolic dysfunction. Now, age-related hearing loss and its important vitamin B12 and folate in the elderly. A prospective study of vitamin intake and the risk of hearing loss in men. Major depression has been associated with lower concentration of several endogenous antioxidant compounds, vitamin E and coenzyme Q10, or enzymes such as glutathione peroxidase, with an impairment of the total antioxidant status. Therapeutic potential of antioxidant compounds as a coadjuvant treatment of conventional antidepressants should be considered. Improved antioxidant defense reduces oxidative stress and boosts immune system and improves depression. Now the most important, we talk more about menopause, but we don't talk much about andropause, which is equally important. Vitamins and minerals that support sexual gland function should be taken to support production of hormone in the adrenal gland. Research has indicated that vitamin D has a positive impact on testosterone level. B vitamins are important for nervous system, for balancing hormones. They also participate in energy production and are therefore essential to deal with fatigue. In case of testosterone, vitamin B5, vitamin B6 are most important. Zinc increases testosterone indirectly by supporting the health of testicles, where the majority of the testosterone is produced in men. Certain amino acids suppresses the breakdown of testosterone and have been shown to increase its level significantly. Ginseng has been shown to increase testosterone, enhance libido, It promotes nitric oxide production, which can improve circulation and may be useful for those suffering from erectile dysfunction. This may be a major problem in a type 2 diabetes, prolonged type 2 diabetes, and they become depressed also. A good option. Ginseng improves mental health and social functioning. L-carnitine improves both the cognitive status and physical function of elderly. Iron supplementation, most important, majority of them, their hemoglobin is normal. But when you check their iron status is low. They have a low quality of life due to fatigue, early fatigue, breathlessness, and now it has become very important to treat iron deficiency anemia even if their hemoglobin is normal. Nicotinamide restores cellular energy level. Multivitamins and minerals are useful in improving alertness, mood symptom, and general day-to-day well-being. Summary. Ginseng improves mental health and social functioning. L-carnitine improves both the cognitive status and physical functions. In elderly, iron supplementation improves functional improvement, quality of life due to fatigue. Nicotinamide restores cellular energy level. Multivitamin minerals are useful in improving alertness, mood symptom, and general day-to-day well-being. So, the indications for such wellness men 50. It improves the age-related problem after 50, cognitive degradation, poor nutritional status, health and vitality, vision improvement, heart circulation, and most important, andropause-related symptoms. Most important problem, one of the problem is benign prostatic hyperplasia, and it ranges in prevalence from over 50% at the age of 60 years. 50% of men have BPH, benign prostatic hyperplasia, at the age of 60. It becomes 90% by the age of 85 and above. BPH is characterized by lower urinary tract symptom, LUTS, like urinary hesitancy, intermittency, weak urinary stream, nocturia, more urine in the night, increased frequency, urgency, and sensation of incomplete bladder emptying. Although BPH is not a life-threatening disease, it affects the individual quality of life in different ways. Impairment of quality of life in BPH patients, mainly because sleep disturbance. They have to get up for urination several times in the night. Disruption of social life due to urinary frequency, psychological burden due to urgency, inadequate sex life, and fear of prostate cancer. Pumpkin seed mode of action in BPH inhibits inhibition of peripheral and placental aromatase, inhibition of 5-alpha reductase type 2, phytoestrogen bind to estrogen receptor. Phytoestrogen interferes with binding of testosterone 5-alpha dehydroestrogen and estradiol to sexual hormone binding globulin. So, effects of pumpkin seed in men with lower urinary tract symptoms due to benign prostate hypertrophy. In 1 year, randomized placebo control, total 1,431 men, 50 to 80 years, with these symptoms were randomly assigned to either pumpkin seed capsule with pumpkin seed extract and with placebo. ALA, alpha lipoic acid, acts as a powerful antioxidant in the body. ALA also functions as an essential cofactor of the mitochondria multi-enzyme complex and plays an important role in energy metabolism. Apart from having anti-inflammatory properties, it also has a positive effects on glucose metabolism and insulin resistance. We do prescribe ALA in diabetic peripheral sensory neuropathy. Epidemiological data suggest a protective role of B vitamins, particularly vitamin B12, B6, and folate on cognitive function. Moreover, B vitamins help to regulate homocysteine level, which risk factors for cognitive decline. Evidence from cross-sectional studies supports link between antioxidant status and cognitive function in older people. ALA reverses age-associated loss of neurotransmitters and their receptor, which can underlie its effects on cognitive function. Coenzyme Q10 acts as an antioxidant, prevents oxidative stress, improves cardiovascular function and male fertility. Bioflavonoids are nature's biological response modifier as they help to react to viruses, carcinogens, allergens by giving powerful boost to the innate immunity, provide natural antiviral, antibacterial, anti-inflammatory, anti-allergy properties, beneficial for fighting infection, free radical damage, and common cold. Glutathione, one of the body's most important potent antioxidant found in highest concentration in liver, heart, muscle tissues, helps maintain cellular health and prevents oxidative stress, greater in content, greater in liver capacity to detoxify. L-carnitine amino acid that doesn't occur in protein, but it is found in muscle tissue, improves energy levels by burning fat as fuel and helps supply energy to muscle, reduces oxidative stress, plays a crucial role in fatty acid transportation, decreases serum ammonia and cirrhosis. Choline amino acid, again essential for proper liver function due to its lipotrophic effects, works well with vitamin B6, B12, folic acid to metabolize homocysteine deficiency associated with adverse hepatic effects. Pumpkin seed extracts lower urinary tract dysfunction and improves overall bladder function. Vitamin C lowers risk of coronary artery disease and improves immune function. ALA restores age-associated impairment in brain energy metabolism. Flavonoids are effective in preventing neurodegenerative diseases. Vitamin B6 supplement improves gastrointestinal disorders. Improves age related after 70. So wellness 70 is most indicated. Overactive bladder can be restored so that they have a good sleep in the night. Cognitive health, immune function, heart health, vision improvement, BPH related symptoms, health and vitality. So these are some pro-hair nutrient for men, like lignan, natural DH inhibitor, essential amino acid, vitamins. Benefits present the surface of the sebum gland skin. So it's indicated hair follicle well-man, androgenic alopecia more than 6 months, telogen effluvium, nutritional hair loss, premature graying of hair. So advanced multi-nutrient formula delivering an expert blend of vitamins, minerals directly to the hair root via bloodstream, offers advanced hair nutrition with amino ligands complex just for men, offers complete hair nourishment for root to tip, offers lignin, only natural DHT inhibitor free from side effects, provides essential amino acid required for hair growth, provides 29 pro hair bionutrients including biotin, calcium, pantothenate, selenium, zinc, awarded. Thank you for your patient listening. Any questions?
Yes,
We will take it.
yes, sir, we have actually. Thank you for your session about the
Okay.
about all the proven efficacies which are relating to men as well as women. I would like to open the entire session for our questionnaire. We have a first question, sir. So, how do you consider, that is, how long to continue the consuming of this supplement? Is there a dosage regimen to be followed for this?
So usually, ideally, we have to check the each vitamin trace element in the blood and see if there's any deficiency and give it till it improves. Because majority of them, if you treat for a long time, you may end up in toxicity that causes a lot of problems. So one should be, but it is not practical in our setup in India at least. to check each and every vitamin, trace element, minerals. So we usually give it for about 3 to 6 months and see the clinical response, and then stop it and reassess them after 6 months. Rekha? Okay?
Yes. So the second question we have over here is, do the multivitamins provide synergistic effect for our overall health and well-being? If yes, then how?
Please repeat.
Do multivitamins provide synergistic effect for overall health and well-being? If yes, then how?
See, basically, multivitamins, as I told, it is required in majority of the biochemical health. So we need to, it will synergistically act with the it will boost the innate immunity, antioxidant property, and free radical evacuation, everything, so that it acts synergetically with the body metabolism.
Okay. So, looking at the current COVID and post-COVID condition, we have a very must be having this question that what are the major multivitamin recommendations we should follow in current and post-COVID condition for men and women of all ages?
I think zinc is most important, vitamin C,
Vitamin D.
vitamin D. These three are more important to boost the innate immunity and to fight against the virus load.
Okay.
Yeah, I feel it is vitamin D, vitamin C, and vitamin E. All are important, especially vitamin D and zinc, other than vitamin C. These are very, very important to boost the immunity.
Okay, ma'am. Ma'am, as you've highlighted about the PMS symptoms and its associated morbidities, requesting you to elaborate on the management of PMDD with multivitamin aid.
You mean to say the PMS?
Yes, ma'am.
Okay. See, first of all, the PMS is, I consider it is more of physiological than pathological, because it is some hormonal interplay in the body that causes PMS. There is more of progesterone logging and progesterone, because of which there is more of water logging. It is a water retention symptoms, other than some people who present with the psychological symptoms like depression or mood swings. It is ultimately more of their mental status and how they can cope up with that. If they can do some pranayama and some breathing exercises and take the mental apprehension into control, then that makes most of the treatment. On top of that, some breast tenderness, some breast pain, this can be taken care of by multivitamins like vitamin C, the biotin, vitamin C, isoflavones, etc. That should be enough. One should consider that it is a self-limiting problem. It is not related to age. It is related to menstruation. It is premenstrual, and in the same woman, she may get for few months, few cycles, and surprisingly, it may disappear after few months for no reason. There will be, they disappear. It's a self-limiting problem. But if the woman on examination, which is mandatory, find some lump in the breast or some discharge, then it is very much necessary to see the doctor, because that is not PMS. It is more a pathological state, and consultation with a gynecologist is very much necessary if there is discharge or lump. Otherwise, if it is just a PMS symptom, as I have told, I think she can manage with self-control and some vitamin supplementation.
Okay. So it is both as well as physiological, as well as you need a supplement in order to cater what we are talking.
Yes.
Ma'am, going ahead, that is most of the times the most unlooked problem in women as well as men, that is the menopause and the andropause. So, what would be your take for the micronutrient and multivitamin supplement for these comorbidities associated with, in case of women, the menopause, and in men, the andropause?
I feel women should take calcium, vitamin D. Either some tablets do come with calcium and vitamin D. They have to take care of the diet. If diet is good in iron and vitamin C, extra iron and vitamin C not necessary, but vitamin D and calcium supplementation, including zinc and magnesium. These four are very much necessary, even if she feels that she is nutritionally sufficient, because in the menopause state there is no great need for iron, but the need for calcium and vitamin D increases, because the consequences of deficiency of these two, that is calcium, vitamin D, is too difficult and too challenging for her. Also, her immune system has to be improved, and as I have already told in my slides, the incidence of cancer goes to a peak in the perimenopausal and postmenopausal women. These antioxidants and the nutrients, which I have already told in my slides, do keep the cancer at check. So to prevent all these uninvited problems, also to maintain her immunity, take care of her self health and well-being, so that she doesn't get tired at the end of exercise, at the end of the day, to get good sleep, to maintain bone health, cardiovascular health, her brain status, that is atherosclerosis, stroke, etc. Women have to definitely take these micronutrients and supplements which I have mentioned.
Okay. Uh, so these are all in all, we need both, that is the multi-nutrient supplement as well as the physiological. Earlier, as you said, that
Yeah,
both
to
should go hand in
maintain the
hand during this
physiology.
management.
Yes, yes.
And ma'am, this is one more question that you are highlighted. Currently, looking at the ecological imbalance which we are going through, there has been a disturbance in the human diet as well. So, what would
Yes.
be your take on the multivitamin supplementation to ensure this balance of nutrients?
I have, in the very beginning of my slides, I have shown that we, of course, nowadays concentrate the knowledge about the nutrition, the balanced diet, the quality of nutrients or the food what we take. The awareness has definitely improved nowadays compared to the previous era. Like our mothers or grandmothers, they would eat what was prepared at home. But now everybody checks on the shelf what is the calorie content, what is the carbohydrate, protein content, the energy, everything. But in spite of that, I somehow feel that we eat more of preserved food. We take canned food, and even if it is a fresh fruits and vegetables what we take, the green vegetables what we take, the soil quality is not that good. The farmer, because of the vested interest, keeps bringing many crops which is not maintained at proper distance, in the sense the cycle, each cycle, according to the period, according to the monsoon, those kind of things they don't maintain. So ultimately the fertility of the soil is not that well maintained. They want more crop, not the quality. The quantity is taken, is the one they look at, and not the quality. And also the lot of chemicals that are used in the soil, even if the people eat meat or milk, whatever, I feel everything is contaminated, and we cannot check the quality or the quantity of the contaminants which are in the food what we take. We are under the pretext that we are taking enough greens and vegetables and fiber and milk, etc. Though we consider it as a wholesome food, I feel that then why should our patients show lot of vitamin D deficiency and vitamin B12 deficiency when we check their blood? Their hemoglobin is, pregnant women hemoglobin is not more than 10 most of the times. We have to supplement, and then only it comes up. If we are so conscious about the diet, and if a quality of diet is so good, why this deficiency is seen? So ultimately what I want to say is, between the what we are supposed to take and what we are taking, the nutrients bridge this gap. Hello.
Yes, ma'am. So all in all, I guess we have covered maximum questions. We are almost. We'll take one last question for today's session. So,
Okay.
ma'am, the question states that what is your opinion about the adjuvant multivitamin therapy in case of chronic conditions like this diabetes, hypertension, and elevated lipid profiles, which are commonly seen post the 40-45 age in men?
So I think they should be on antioxidant, minerals, and vitamins on a regular basis. Those who are chronic, non-communicable diseases like diabetes, blood pressure, increased cholesterol, coronary vascular disease, cerebrovascular disease, they should be on one capsule of antioxidant every day to take care about further progression in the vascular health.
So,
Because they boost the immunity, they maintain the health of the vessel. The endothelial cells are kept healthy once the micronutrients are enough or in abundant state in the body. So they can prevent the subsequent problems like the stroke or the myocardial ischemia or even the renal disorders, the joint health. Osteoarthritis is doesn't progress if the connective tissue is maintained in a good state. So it's a multi-pronged approach.
yes, ma'am. So, thank you, ma'am. I would like to present on behalf of Mayor Vitabiotics. I would like to thank Dr. Rekha and Dr. N.Rajendrakumar for such an insightful session on proven efficacies of micronutrients in wellness through ages. It was really a thought-provoking session, and I hope all everyone can inculcate this in their day-to-day routine. I once again thank all the delegates for attending and being a part of this webinar. Thank you for your patient listening and keep continuing your support for total healthcare therapy for men and women, that is Wellman and Wellwoman range containing essential nutrients and vitamins and
Yeah.
catering. So thank you.
Yeah, thank you all. Thank you, Mayor Vita Biotics, and thank you all the participants. We have taken your time. I hope the both the presentations were informative, and wish you all good luck and good health. Thank you all. Wish you a happy Sunday.
Thank you.
Thank you so much for all that.
Thank you. Shall we close the session?
Yes, ma'am.
Yeah. Thank you all. Good luck. Bye.
India ಬೇರೆ